just to start the conversation. So things that I think we should talk about. Physicians desire a stable pension. Let's start with that. What has been done so far? What has been created so far? Who was it designed for? That's important.
Yep.
Because it wasn't designed for us, for sure. What are the physician needs? We talked about this. Accumulation needs, tax efficiency, estate, the intergenerational wealth.
Well, what about flexibility?
Okay, yeah, flexibility.
Flexibility and control.
I'm going to put it here. Flexibility and control. Anything else?
The theme there is loss of control over surplus. This is generally loss of control over assets. And it's all one theme. So you don't control the investments, you can't put insurance, it's locked in. Like imagine you're a doctor and you get diagnosed with something that says you're going to die in the next 5 years, but you'll be relatively healthy for the next year. You might want to strip out all the surplus and go on a cruise around the world.
Mm-hmm.
Not get 6% indexed into your pension when you're 95, because you won't get there.
Yeah, but can't you, under HOOPP, can't you take that community value out?
It's locked in. Okay. You could unlock all of it if you have a life if your life expectancy is 2 years or less. If you have a doctor's note that says you will die in the next 2 years, you're allowed to unlock all of your pension money.
How's my financial health, Doc? Welcome to the Financial Literacy Podcast for healthcare professionals, where financial security and wealth topics are not a taboo.
And here we go. So good morning, everybody. Welcome to How is My Financial Health Doc podcast. And I am back. I'm your host, Vu Ketran. Today I have with us my good friend and my business partner, Mr. Jean-Pierre Laporte. And we are going to be talking about this new multi-employer pension plan that has launched. And, has launched. I'm saying this because this podcast is published at the same time as the launch of this new multi-employer pension plan, even though we recorded it a few days before. And this is the first time I do something like this because this is really breaking news and hot off the press. And a few of my colleagues and physicians have already contacted us, and a few financial planners have already contacted us and wanted to know what this is and what's the impact, and more importantly, what's the impact for physicians. So we decided to do a breaking news podcast, and this is what this is. And so we're going to be talking about this new multi-employer pension plan called HOOPP that will be released to the incorporated physicians in Ontario. So before we do that, let me introduce JP and welcome to the show. JP, good morning.
Good morning.
How are you doing?
I'm great. Glad to be back.
Okay. How's Montreal weather today?
It's blue sky, beautiful, and of course, very cold.
Always 5 degrees lower than Toronto. Always. Okay, so JP, we cannot do this show without disclosures. So I'm going to start with my disclosure, as people know, and I hope they know, but if not, here's the disclosure. JP and myself are the co-founders of the Canadian Physicians Pension Plan. And this is important because we are talking about pensions, but more importantly, we're talking about another pension. So it is important that we disclose that. And we are the co-founders, and I have the role of president as of the Canadian Physicians Pension Plan. JP,
And I'm the treasurer.
treasurer of the Canadian Physicians Pension Plan. So remind JP, what do you do in your regular life other than being the treasurer?
I am the CEO of a pension consulting firm called Integris Pension Management Corp that sets up registered pension plans for Canadian entrepreneurs and business owners.
Wonderful. Okay, so disclosures are done. So now let's go into the topic because this is really timely and this is really important. Actually, this is historic as well. For years and years, physicians have been asking for a pension plan. And I myself explained to you many moons ago. I started this podcast during the pandemic. And at that time already, I was talking about physicians wanting pension plans, and I call this pension envy. And so a lot of associations have been trying to figure out what to do. And I don't think that many have succeeded or have put much attention into this until the Ontario Association put some focus onto this. And now they have been able to add physicians into the HOOPP, which is really the Healthcare of Ontario Pension Plan. So starting January 2025, which is about 2 weeks from now, Ontario physicians will be able to join this really nice plan. And so let's just recap what is available in the market right now, JP. What type of retirement saving plans, without really calling them pension plans for now, what type of plans are available in the market right now?
Well, this is part of the problem. Physicians are bombarded by all kinds of different alternative models to save for retirement. On the one end, you have insurance carriers that will offer permanent life insurance policies. You'll have accountants telling physicians to just save their money inside of their medical corporation in a non-registered corporate investment account. You'll have people telling physicians to just sign up for an RRSP or a tax-free savings account. You'll have people saying, join a group RRSP. There are other promoters that are saying, join a defined contribution pension plan. Others are proposing specified multi-employer pension plan, which are defined benefit in nature, but funded like a defined contribution plan. There's also your IPP providers, individual pension plans. And then finally, there's the Canadian Physicians Pension Plan, which is the federation of pension plans for individual medical corporations. So there is so much variety out there, so many different ways that physicians can save for retirement. And I can understand why it becomes bewildering to try to make sense of it all.
In fact, indeed, it is very, very confusing for most of us. You are a pension lawyer, so you know this and understand this like the back of your hand. For us, it's a totally whole new language, so it is a confusing market for us. But needless to say that since the Canadian Physicians Pension Plan launched 2.5 years ago, there are much more now in the market, as you mentioned. Now, some of them are RRSP, some of them are not even uh, registered plans. Um, but in terms of pension, what are the ones that exist? We talked about the SMEP.
Yeah,
That's a pension plan.
Yeah, you can join a defined contribution pension plan. You can join a group RRSP. And nowadays, of course, with the Canadian Physicians Pension Plan, you can have sort of that type of structure. And with the introduction of HOOPP, now there is the possibility of getting a classic defined benefit multi-employer pension plan solution.
So let's go into that. Define to us what HOOPP and a classic defined benefit plan means. And again, just to be high level, we don't have to go into the nitty-gritty details here.
Yeah. Well, HOOPP, of course, is the healthcare onto your pension plan, but it's a multi-employer pension plan that offers a defined benefit pension. That's what you're promised when you join. You're told, we will pay you for the rest of your life a fixed pension calculated by reference to a formula. And the formula is found in the plan text. And what it's supposed to do is to replicate about 70% of your pre-retirement income in the form of a pension. But it's pre-retirement income up to a maximum. So I'm not talking about someone who's pulling out $500,000 in salaries. It's capped every year by what's called a maximum pensionable salary. So about $180,000 this year, for example. So you get 70% of that paid to you in the form of a regular pension once you stop working. That's what a classic defined benefit plan. And examples are like the Teachers Pension Plan of Ontario, the even the Canada Pension Plan is a form of defined benefit plan, although it's funded quite differently. So those are your classic defined benefit plans.
So how does that plan work? So I'm promised a salary at time of retirement, which is the defined benefit. And so how do I contribute every year? What is defining that?
Well, the terms of the pension plan will establish a contribution level, a percentage of your salary that your employer, and in the case of physicians, would be the medical professional corporation. So the medical corporation has to pay the doctor or physician a salary, T for income, and then a percentage of that salary is what is required by the plan text to go and fund this promised pension. But it's one big pool. So you have everybody, all of these different multiple employers, all pitching money into one communal pot, which is called a pension fund. And out of this communal pot, when doctors are eligible for retirement, that's where the money comes from to pay that stream of pension promises. All these monthly benefit pension amounts come out of this centralized pool.
So let me ask this question in another way, just so that I understand and our audience understand. So I'm contributing to this HOOPP, let's say, Dr. Tran MPC is contributing to this pool, and I'm taking a T4 of, let's say, 200,000 per year. And my other HOOPP members, let's say the administrative worker at one of these hospitals, her salary is, let's call it 70,000. And that's her T4, right? Her T4 is 70,000. My T4 is 200,000. Do we contribute the same amount, or do I contribute more than that administrative assistant?
No, you would be contributing more because it's a percentage of your salary. So if your salary is higher than the administrative assistant, the amount that your medical corporation contributes would be higher.
Okay. And so with that thought in mind, so let's say I'm 45 years old and the administrative assistant is also 45-year old for comparison. So because my T4 is 200,000, I contribute 30,000 because of my salary. And this is just an example for argument's sake. But the administrative assistant puts into the plan, into the pot, let's call it 6,000. So because her salary is much lower, she put 6,000. Because my T4 is higher, I put 30,000. Is that correct? And again, these numbers are just hypothetical, but the concept, is that correct?
Yeah. Your age isn't really relevant under this structure.
Okay.
It's not like an individual pension plan where as you get older, the percentage that you contribute to the plan keeps going up. This is not how these centralized defined benefit plans work.
Interesting. So a physician who's 45 years old versus a physician who's 60 years old who joins the HOOPP will contribute the exact same amount if they have the exact same salary,
If they have the same salary, yes.
which is different from the IPP and PPP.
Correct.
Okay, so two things here that you've just said that is very important. One, if I'm comparing myself to administrative assistant, I make much more, therefore my contribution to the plan is much more. That's point number one. And that is important because I contribute for 30 years and she contribute for 30 years. And so that means that she will contribute 180, sorry, 30 years times 6,000. So it's 180,000 over the span of those 30 years. But the physician who is contributing 30,000 for 30 years, that's 900,000.
Yep.
So the physician here, Dr. Vuketran, MPC, the employer has contributed significantly more.
Yep.
The second thing that you said is that Dr. Vuketran, MPC, Dr. Vuketran is only 45, but Dr. Smith is 60. If we have the exact same T4, call it 200,000, even though Dr. Smith is older and nearing retirement, Dr. Smith is not allowed to contribute more. We are contributing the exact same amount.
Yeah.
And that has repercussions, and we'll talk about that in just a minute. So these two concepts have significant repercussions for the physician. Okay, so JP, when HOOPP was designed and created in January 1960, who was it for? Who was it designed for?
Well, there's a whole bunch of classes of employees, and I think you have some of them with you, but they were really meant for people that work in hospitals. HOOPP used to be called the Hospitals of Ontario Pension Plan. So it was only that portion of the healthcare system that was targeted by this plan.
So the members who are part of the hospital are obviously the nurses, the PSWs, the RPNs, the medical technologist, the lab technologist, the administrative assistants, and housekeeping, and also dietary and food services. Because physicians were never considered employees of the hospital, physicians were never part of the design of this plan, were they?
That's right. That's right. As independent business owners, as professionals, the physicians were not offered membership into HOOPP.
Okay. Now that is important to keep. That's a third concept that I think people need to remember because this plan was in fact designed and structured for a different group of people. It wasn't really structured for doctors and MPCs. And so we'll discuss this as we go along, why that is important. Let's talk a little bit about the plan itself. The plan has been in existence since 1960. It has 460,000 members across 670 employers. It is a great plan, isn't it?
Oh, it's my favorite. I love HOOPP. I think it's probably the best run pension plan in Ontario and perhaps even in Canada.
So
It's
tell us why. Share with you what you understand and the secrets of HOOPP. Why is it such a great plan?
Well, it's extremely well managed. Not just the investment returns, which have been superb for at least 20 years, they've been in surplus. So they're earning more than they need in order to pay the promised benefits. So they're building up a huge reserve of surplus, which allows them to provide enhancements like indexing to inflation, for example. And then not just the money aspect, but even the administration. They have an incredible website. Everything is disclosed. Their plan text is available online for download. And they have great frequently asked questions. It's just an incredible pension plan. Like this is I would say the, the the closest thing to perfection if you offering a defined benefit pension plan, a classic defined benefit pension.
It is very understandable that if I was in healthcare and I was offered this plan, I would be really unwise not to accept it.
Well, you have to. It's part of your terms of employment when you're hired by the hospital. They give you a pay, but they also say you have to join HOOPP. So
Okay.
you don't really have a choice.
Well, I see this a little bit like the seatbelt, right? I'm supposed to do it by law and I have to do it by law, but it will save my life. It has a whole bunch of benefits. So I see this as a really, really good safety net.
Yep.
And like you said, it's not just a good plan, it's an amazing plan. Phenomenal plan. So for me to be having access to this plan as a hospital employee would be like amazing, phenomenal. There's no reason why I shouldn't do it. That being said, I understand how great this plan is. The next question is because this plan was never designed for physicians and it was never designed for MPCs, what are some of the needs that this plan does not meet? And let's just go 30,000 level for now. Okay. So, what are the physician's needs that we need to think about financially when it comes to retirement planning and saving?
Yeah. This is where there's a big bifurcation between a nurse working for a hospital and a physician that's incorporated and that is a medical professional corporation. Very different animals. The problem that the physician has, the problems with an S, is that not only do they have an accumulation need, they need to stash away as much money as possible to try to replicate how much money they were earning while they were practicing in retirement. So that's the accumulation question. But they also have a tax problem because they're not just dealing with themselves like the nurses. They also have to contend with corporate tax, which is all the tax that their medical professional corporation is facing, plus their personal tax if they're pulling money out of their corporation. So the physician who's incorporated has a much more complex tax problem than an employee working for a hospital. And so it's those twin problems that make the solution has to be tailored to their two problems. And HOOPP is great in the sense that it will help you with the accumulation issue because it's a great plan, like I said, probably the best one in the country. So if you put money in it, you know you're going to get your promised benefit most likely, but it doesn't solve for the tax problems of having a medical corporation alongside. And remember, you need that in order to join HOOPP. So it's not like you can just say, okay, I'll stop having a medical corporation. I'll just become an employee of the state or the hospital and join HOOPP because that's not how the system works. You know unless unless you're in certain very small areas of medicine, you're not allowed to do that.
Well, yeah, there are some few exceptions, as you say, very small areas of exception. One of them that I know are physicians who are not incorporated, but they've signed a contract as an employee to work in what we call CHCs, so community health centers, for example.
Mm.
These are clinics that are run by the ministry, right? So they have signed a employee contract with the ministry to work in these clinics. And so these are very, very small proportion of physicians. The vast majority, as you say, are self-employed and having incorporations. And I would say that what are your thoughts? Like, do you think currently in Canada, maybe 60 or 70% of physicians have a professional corporation by now?
I was told through the grapevine that it was over 80%.
Over 80%. So this definitely will apply to 80% of us at this point, right? We would be eligible. Um, Now you mentioned physician needs with an S. There's two more that you didn't really mention yet. So what are these?
Well, those are they're important, but perhaps not as much as the first two. I mean, there physicians have a need for flexibility and control, like everyone else. You don't want to be in a straitjacket if you can avoid it. Also, there's some estate needs. Now, some physicians don't have children, don't have anybody to give their wealth to, but many do. And when that's the case, there's some estate needs. You want to make sure that you pass as much wealth to the next generation as possible to look after your loved ones. And so all of these needs are important. And as we discuss the HOOPP situation, the HOOPP solution, you'll see that when we compare and contrast it with the Canadian Physicians Pension Plan, the latter is a lot more powerful to deal with these needs.
Okay, so let me recap in our mind what are the four needs of physicians when it comes to financial planning here. The first one is accumulation. So, how much can I save in retirement through a solution? The second would be the tax efficiency need. How much am I leaking year after year after year for the next 30, 35 years as I'm practicing my medicine? The third one I think is major, which is the estate need you mentioned about, because vast majority of us have families. Now, there's obviously a small minority of us who don't have families and don't have children. I get that. But the vast majority still have families and children. So the estate planning need and the legacy and the passing of wealth to the next generation is, in fact, a need. And finally, flexibility and control. So those are the four needs financially that physicians need to think about. As I understand it, and we'll go through this right now, is that HOOPP, while very attractive and phenomenal plan, meets the accumulation need, but does not meet the other three needs. So let's go through some of these together then. JP, how about we talk about the tax efficiency? Uh, what what is his that we still don't understand, or maybe saying that way is wrong. What is it that physicians need to understand about HOOPP and how it is structured and legally structured before we jump into it? And so, what are the things we need to know about tax efficiency here?
Well, first of all, the funding model of HOOPP is that for every $1 that the employee contributes out of their salary, the employer contributes $1.26. That's the funding model that HOOPP has adopted for funding so they're getting money both from the employer, from the Medical Professional Corporation, and from the employee. And so all that money goes into the central pot to sustain those promised pensions in retirement. And this is kind of ironic, but because the money managers, the portfolio managers at HOOPP have been so incredibly stellar at generating returns, that the plan has been in a surplus situation for the past 20 years, which means that the opportunities of the employers to make extra tax deductible contributions, the way that you're allowed to do with our CPPP, doesn't exist. So, for example, as you know, when you have an individual pension plan or personal pension plan and part of CPPP, if the rate of return is below 7.5%, we have the ability to top up the special payments, which means monies that would have been taxed, let's say, at 26.5% inside the corporation, instead of being taxed at 26.5%, it's taxed at zero, because that money is contributed to the pension plan, to the IPP, the PPP, as a special payment. And now that money is going to grow tax sheltered in the future. So that's one example of something that cannot be done with HOOPP because they're in surplus. There is no deficit to talk about. The other one is the ability to accelerate contributions through what are called the terminal funding rules. So these are the rules when you decide to turn on the pension ahead of schedule. And you're telling the pension plan, I want to start collecting my pension now. I don't want until 65. And because maybe you want to take fewer shifts, maybe you want to enjoy your life more. Well, you can't use the terminal funding rules in a pension plan that's in surplus because there's nothing to fund. Your early retirement will just be funded out of the existing surplus that's been built up inside the plan. So yeah, you can retire early, but you're not giving your medical corporation massive tax deductions along the way. So monies that, you would have been paying in taxes, you can't save those. You have to pay the tax authorities because there's no ability to do terminal funding under HOOPP. So those are just two examples of how over time the medical professional corporation's tax position can't be as efficient as with us.
There's a reason why I brought up the idea of the 45-year-old physician versus the 60-year-old physician. Because Dr. Tran is 45 and contributes, again, I use the number 30,000. And the 60-year-old physician also contributes 60,000. Sorry, 30,000. The 60-year-old contributes 30,000. So the 60-year-old physicians do not get to enjoy increased contribution that they would be allowed in an IPP, PPP. So even in that scenario, they lose the opportunity to deduct more taxes. Am I understanding this right then?
Yep. That's a third example of tax inefficiency that comes with not being able to contribute more when you have an IPP or PPP. If you're using HOOPP because it's fixed, it's not fixed in stone because they reserve the right to change the contribution percentages, but it's pretty standard across all employees. And so the only variable is your salary.
So that for me is a real disadvantage. Like, for example, I'm 45 years old, I contribute 30, and the 60-year-old physician is also contributing 30, but they have worked so much more, accumulated so much more in retained earnings possibly, and now in their corporation is facing much more tax burden than I would. But they're not given that chance to actually reduce that because age is no longer a factor.
That's correct. Well, I mean, just in passing, just open up a little parenthesis. This is the same issue with specified multi-employer plans,
True,
where the
correct.
contributions are capped at 18%, even 60 years old. It's the same as if you were 20 years old. So it doesn't account for the age difference. So you end up with lower tax deductions.
Correct. So that for me is a true, real disadvantage. In addition to the two that you mentioned, but this is yearly, right? Every year I lose that
Yep.
opportunity.
Yep.
Okay, so in regards to the estate planning needs, the intergenerational wealth portion of it, explain that to us. Why HOOPP does not allow that or is not efficient?
It's important to step back and try to recall what the law says. How does the pension money gets dealt with when you die? If you are in pre-retirement mode, meaning that you haven't taken your pension yet, you're just building up your pool of money, your pension entitlement, and you die, the commuted value, so sort of the equivalent of the money you put in plus some factors, can be transferred to your spouse, and your spouse gets this pool of money. It opens up RSP room, so the spouse pays no tax. And if you don't have a spouse, then you can designate beneficiaries, assuming you have children or your preferred charity or your preferred hospital, whatever. And then the monies can be distributed to your beneficiaries. So that's the pre-retirement debt. That's fine. We don't have any issue with that. But what happens when you die in retirement, when you started your pension and you're collecting your monthly pension or annual pension or whatever? If you have a spouse and the pension that was promised to you was what we call a joint survivor pension, then upon your passing, your spouse continues to receive your pension payments. Now, they could be 100% of what you used to get, or they could be all the way down to 66.6% or anything in between. And this is great. The only thing is, this only lasts during what's called a guarantee period. So if you, and the guarantee period, just so you know, is 5 years when it's a joint and survivor pension. So if both the physician and the spouse died during the guarantee period, well, that's fine because the missing monthly payments from the date of death till the end of the guarantee period would be payable to the beneficiaries. So there's no loss there. We're good. But what happens when both the physician and the spouse pass away after the 5 year guarantee period? Well, the thinking is that the pension plan has done exactly what it promised to do. It promised you, physician, a pension for the rest of your life. Unfortunately, your life ended after 6 years of collecting payments. Let's say it's a death in year 6. And it also promises a joint survivor pension to your surviving spouse for the rest of your spouse's life. But they have discharged that obligation as well because surviving spouse is dead. Any money left over, which could be millions and millions of dollars, is now considered an actuarial gain to the central pension plan. So the monies that you thought you were going to use in a long, retirement end up in the pool stay in the pool. There's nothing more owing to your family. So that's what we call the actuarial gain. And it could be in the millions of dollars. It usually is. So that's, to me, is a flaw that all classic defined benefit plans in the country suffer from, whether it's the teacher's pension plan or other types of specified multi-employer plans, the HOOPP plan, the General Motors plan for auto workers. They all have that issue. As you probably know, but your listeners may not know. Under the Canadian Physicians Pension Plan, the structure is different. So if there are millions of dollars of surplus resulting from a death outside of the guarantee period, what happens is that surplus is now available for the family. It can be paid directly to the family members. It can be paid to the medical professional corporation. If there are still plan members inside the plan, it could stay there and just keep growing tax sheltered for decades. So the surplus management, the ability to control those millions of dollars beyond the grave, is one of the probably the biggest Achilles heel of classic defined plans.
Thank you for that explanation. So I'm going to unpack it a little bit and just maybe give an example. So Dr. Smith is joining this HOOPP plan and contributed for, 35 years. And Dr. Smith takes this pension, and in year 6, unfortunately, Dr. Smith passes away and the spouse passes away. And over the span of 35 years, let's just say Dr. Smith accumulated $5 million. So he's got a total of $5 million. But after 6 years, he's only used, we said 108, so 110 times 6, so 660,000. That's what he took. But then there's another 4 point something million. So what you're saying is those 4 point something million stays in the central pool for everybody else. The medical technologists, the lab technologists, the nurses, the food and dietary, those 4 point something million will not go to the children because we are past that guaranteed period. We're at that 6 year mark now. And there's no spouse to pay the pension to.
Exactly. That's what an actuarial gain is when there's money left over because the liabilities, the promised benefits have been extinguished. They've been extinguished by death. So if the pension plan no longer has an outlet, you can't pay a pension. The physician is dead. Can't pay a pension to the spouse. Spouse is dead. So what's the plan supposed to do? So they just hang on to the money. They say, well, this is a gain for us.
Right. So that is a major, major flaw that physicians who join this plan need to understand. Beyond the guaranteed period, there is no possibility to leave money to your children. Now, this concept that you just talked about speaks to the loss of control over surplus. So it's not just about death. You mentioned also other scenarios. For example, there's no control over the surplus management of money. So what if I have an emergency need? What if I have a medical need? Can I take that money out?
Well, no, you can't take money out of the HOOPP plan. It's locked in. And besides, it's not the individual physicians or plan members that control the surplus. It's the board of trustees. So they're the ones who call the shots as to what, if anything, will be done with surplus dollars that exist. So the physician can't say, "Hey, I just found out from my oncologist that I'm going to die in 5 years, but I'm going to be fairly good for the next year, and then it's going to get progressively worse." The physician that gets this sentence doesn't have the ability to say, I'm going to pull $1 million out of the surplus and spend it and go on a trip around the world and enjoy myself. Because they don't have the power. They don't control the purse strings when it comes to the HOOPP surplus.
One of the examples you gave was cancer and 5 years. What about physicians who are diagnosed with, rheumatological diseases, multiple sclerosis, who have, potentially suffering for the next 5, 6, 7 years before they pass away? Can they take that surplus out? I'm assuming the answer is no, because they don't control the
That's
management
right.
of the surplus.
That's right. They don't control the surplus, so they're just entitled to their pension.
But they have potentially 4 or 5 million sitting in there.
Yeah, but they don't control it. This is not a individual pension plan or a personal pension plan. This is a group defined benefit pension plan where the assumption is that the employer knows best and the employer is really the person that's running the pension plan. And so, if you're a nurse, not to, say anything bad about nurses, but they're not seen at the same light as an incorporated physician. They're entitled to their pension. That's it. If there's surplus, it's not for the nurse to determine how that money is going to be pulled out. They have no voice, no say. And it's the same thing for these physicians. They're going to be joining the plan. They will have no say as to what to do with their portion of the surplus they built up by contributing all these years.
Well, that's why I said earlier, HOOPP was not designed for physicians, right? Physicians will be accepted into HOOPP in January 2025. But this plan has been in existence since 1960. So the associations are thinking, I'm doing a great thing for my fellow physicians, but in fact, we are an afterthought in this plan. We're not, our needs are not even taken into account here because
Well,
we're not the same as the nurses or the food and dietary services.
let's be fair. It's certainly better than a group RSP.
I agree.
It's even better than defined contribution plan.
I agree. But
But
but there are other solutions.
well, I know, but I'm just saying the association hasn't bothered to offer the other solutions. They just picked this.
Well, I understand why they picked this because it's the nicest and most solid, as you say, and it's a phenomenal plan. But I don't believe they did their due diligence in understanding all the other plans available. So I want to come back to that idea that, the administrative assistant is contributing 6,000 and Dr. Smith is contributing 30,000. So again, we mentioned over 30 years, that's a significant chunk of money. But the physician is, in fact, contributing more to the plan than the administrative assistant, right? Because we talked about 6,000 times 30 years versus 30,000 times 30 years. The physician will contribute much, much more to the plan. So the plan will grow faster, much bigger, because physicians are now coming into the plan if they choose to. But they don't get the reward. They don't reap the reward because after that guaranteed period, everything's gone.
Well, it is for sure the fact that if physicians adopt HOOPP in a big way, the assets under management will will be expanded significantly because, as you said, physicians can afford to pay themselves a much higher salary than a nurse from their MPC. And since the contributions are a percentage of the salary, there will definitely be significantly more money in the central pool if physicians flock to this solution.
Right. Now, physicians who take that amount of salary because of life needs, it wouldn't make sense to join HOOPP. It would make sense to join the other pension plans in the market, such as an IPP or PPP or even the Canadian Physicians Pension Plan, given how this is structured.
Well, I mean, if you don't have children and you don't mind leaving the millions to the central pool, then yes, there's nothing wrong with being in HOOPP.
No, but you can also decide to leave your money to charity as opposed to leave it to HOOPP. So let's come back to the idea of loss of control. Now, there's also loss of control over assets. What did we mean by that?
Well, I mean, again, there's a central pool managed by professionals who are extremely good at managing money. I mean, I start off by saying it's my favorite pension plan. Well, short of the CPPP. Um, so you don't have any control over how your money is invested. You know, you may have like some doctors I know only want to do Sharia compliant investing. They don't want their money to be in interest bearing investments. Others have environmental or social or governance requirements. They don't want their pension plan to be invested in cigarette manufacturers, even though that may be a very profitable investment to be in. You know, especially if you're, uh, working in that field and you see damaged lungs all day long. You may not want your pension plan to be invested in that. So you have no control as an employee, as a plan member, as to how your money is invested. But you would have control if you were in an IPP, PPP, or CPPP. So that's important. And then in terms of the asset classes and the types of investments that are permitted by pension legislation, if you are part of a centralized system like this, like HOOPP, there's certain things that you may not even have access to. Where I'll give you an example, like with us, you can invest in terminal life insurance policies, which pay sometimes millions of dollars in death benefit extra. It's almost like having a dividend paying stock with one massive dividend upon death. So those types of investments don't exist in the HOOPP system. So you can't really innovate. You can't really take advantage of insurance policies. So for me, that just in my opinion, that's a loss of control that physicians who sometimes are very, very sophisticated when it comes to finance, they may want to have that as part of their solution, but they give up that control when they join a centralized pool.
So now let's talk about another loss, another type of loss, and that is the loss of flexibility. So we talked about, one of the physician needs was flexibility and control. So flexibility is lost because HOOPP is governed by the Pension Benefits Act in Ontario. So what does that translate to?
Well, there are certain extra rules that wrap around HOOPP that don't exist for our IPPs, PPPs, and the Canadian Physicians Pension Plan. And these stem from the application of the Pension Benefits Act. Remember, this is only for Ontario physicians, so it's the Pension Benefits Act of Ontario. And that statute um, does a bunch of things. One of them is it says when the employer has to contribute, that contribution is mandatory. So there's no flexibility. You can't say, you know what, this year, instead of putting money in the pension plan, I would rather give a big gift to my child who just bought their first home. So I'd rather direct some money to my child to help them with their first home. The money has to go into the pension plan. Once those mandatory contributions are made to the pension plan, they're locked in by the statute. While there are some exceptions as to how you can unlock money and get it out, but generally, locked in money cannot be withdrawn until retirement. So if you have an emergency and you need to access your pension funds, you can't do that when the plan is governed by the Pension Benefits Act. Luckily for us, for IPPs and PPPs and CPPP, because the physicians control their medical corporations, the entire pension plan is exempt from the Pension Benefits Act. So we don't have mandatory contributions. We don't have locking in. We have total control over whether or not we can access our own money. So that's really the big difference. I mean, there are some other differences and some nuances, but those are the basic principles.
So let me again unpack that a little bit more because you talked about, well, Dr. Smith wanting to help with his child's first home, but I'm going to give you something even more simple than that. What if Dr. Smith broke his hip because he went skiing one day? And that year he has to go through surgery and rehab and not working 100% and was only working 30-40%. And that year or 2 years is not making the salary that he or she was making before, but now is still mandated to contribute that 30,000. Dr. Smith has no choice. He has to, or she has to come up with that 30,000 somehow.
Well, I mean, if the salary is lower, right, it's a percentage of salary in the HOOPP. So if it's a lower salary, then the contributions that the MPC has to contribute would be lower as well. It does have a long-term impact, though. It means that your total pension won't be as great because you've got a depressed year of service. So it will have a long-term effect of reducing the total pension you're entitled to get. If you are still taking the side, because you gotta still live, you still have to pay your groceries and your gas money. If you're taking a salary, you are bound to contribute, even if the underlying employer, your medical corporation, is suffering that year. The Pension Benefits Act doesn't care. Like, you must contribute. And in fact, if you don't contribute, you're subject to fines.
Now, you mentioned the locked in feature. I contributed the money, and 10 years later, you know what? I don't want to do this anymore. I'm getting out of Hoop for whatever reason. Some people do that. What happens to that money? You said it's locked in. Is it locked into a lira?
Yeah, well, I mean, the pension plans have, including HOOPP, have what are called portability options. So the most classic, usually the most used portability option is a transfer to a lira, to a locked-in retirement account, which is really a fancy word for an RRSP that has some extra locking in provisions wrapped around it. So when you open the RRSP with a financial institution, because the source of the money was a locked-in pension plan, the financial institution has to put extra restrictions around your money. So you're not allowed to just liquidate it the next day. So that's why it's called a lira, locked-in retirement account. And most people do that when they leave a classic defined benefit plan. Other options, I know you didn't ask for it, but I'll tell you very quickly, would be to purchase an annuity, which is its own form of locking in, because what is an annuity but you writing a big premium to an insurance company, depositing that into an insurance contract, and not having access to that insurance contract unless you get an annuity payment every month. So it's another form of locking in, just not called that. So those are the two classic portability options. They come with all kinds of restrictions. Now, they're luckily for physicians that are over the age of 55 in Ontario. A few years back, the legislation was changed. And if you are over 55 and you're transferring money to a lira, you do have the option to unlock up to 50% of that money. and have that 50% go into an RRSP, where of course you'll now have control over it. You can collapse it and take the money out, pay your withholding tax. If you have what's called a shortened life expectancy, if another doctor tells you you're going to die within 2 years, you do have the ability to unlock 100% of your locked-in money. So there's a few other exceptions if you leave the country and all that. The general rule of thumb is that a chunk of your pension money that originated inside of the HOOPP plan will continue to be locked for the foreseeable future and therefore not accessible to you.
So we've kind of talked through the different drawbacks of this plan despite its phenomenal structure. This structure HOOPP meets the accumulation needs of the incorporated physician, but it definitely does not meet the need of tax efficiency, estate needs, flexibility, and control needs of the incorporated physician. So when we are looking at these plans in the market, and again, there are a few, we named them. We think, you and I think that the Canadian Physicians Pension Plan, which is based on IPPs and PPPs, meet all these four needs. That's why we created that way. But there are other plans in the market. And I think the message that I want to communicate, and I believe JP, you want to communicate too, is, not one person's the same. Not everybody's the same. Not everybody have kids. Not everybody have the same aspiration. So when you think about a big plan like this for everybody, you must kind of figure out, do you fit into the everybody? And if you don't, then you really have to understand this plan very carefully and do your due diligence before signing on to any plan. Any plan. Do your due diligence, understands the pro and understand the flaws, because some of these flaws may be major in your financial goal, may be a real roadblock to your financial goal.
Yeah. Well, I mean, the way I look at it is like everything else in life, there's always a bit of a hierarchy. And, CPPP is really an elite product because it was designed with all the advantages of the Income Tax Act all put in it. And then you go down from there and you have great solutions and they meet certain things, but they don't meet others, all the way down to keeping the money in your corporation, which is the least effective way of saving for retirement because it's fully taxed along the way. You're leaking tax all the time. So it's really a question of gradation and hierarchy. I mean, it is a free country, right? People can do what they want with their money. We just want to let them know that even though HOOPP is an incredible solution, it's a big breakthrough, and it isn't at the top of the hierarchy in Canada. And that's where CPPP is.
Right.
People don't know about it because the Medical Association isn't promoting CPPP.
Well, they're not even promoting the others. Like again, HOOPP is a phenomenal plan. It's just that it was not designed for the incorporated physician in mind.
Nope.
And other plans are, for example, the CPPP. Unfortunately, associations have not compare and contrast these plans because they don't have the expertise. But yet they've kind of pigeonholed their members into one plan without really understanding what's in the market. So with that, JP, let's conclude our podcast here. Are there any last words, things that's burning on your chest that you must say before we say goodbye?
It's the same that I always say every time you invite me. I say, please do your due diligence. Get expert advice before you commit to a long-term pension solution. Don't do it on the back of a napkin just because someone told you to do it. It is something that you will regret very much if you haven't taken the time to get informed about that decision.
And I want to come back to your notion of expert advice. So expert advice is getting advice from someone who actually understands pension and pension laws, like yourself, JP. if you want to understand pension, but you go to an accountant, they may not know. If you go to a investment advisor, they may not know. So the same thing, if I want my patient to be assessed for, a certain cancer, I'm not sending them to a dermatologist, right? They're both specialists, but they're specialists in very different areas of practice. So if I want to understand pensions, I should go to someone who has expertise in pensions, not in accounting. So thank you very much, JP, for your time and for giving us a little bit of the under the hood of HOOPP.
No, my pleasure. I can put my toque back on and go into the cold in Montreal.
There you go. Enjoy. I think you wanted to do ski today, right?
Oh, there's not enough snow for that.
Not enough snow. Okay, well, hopefully you'll get some soon. Cheers.
All right. Take care.
I know this was a very long podcast, so thank you very much for listening this far. I hope that this was a good podcast, a good episode, because associations are now telling us we can join HOOPP. And as mentioned, HOOPP is a phenomenal plan. Unfortunately, it may not be for the incorporated physician. So please do your due diligence. I also want to take this opportunity to remind people of the Code Green Financial Conference happening on February 15, 2025 in Toronto at the Old Mill Inn, where we're going to be talking about topics such as financial planning, investing, real estate, insurances, practice management, pensions, and everything finance under the sun that is relevant to the physician and healthcare professionals. So please join us at this conference. To register for the early bird, which is until December 31st. Registration is at www.codegreenfinancial.com, and we are looking forward to seeing you there.
How is My Financial Health Doc podcast is hosted by Dr. Vukit Tran. Dr. Tran is a physician with a special interest in personal financial security and wealth education. Dr. Tran does not render or offer to render personalized investment or tax advice through this financial podcast. The information provided is for informational purposes only and does not constitute financial, tax, investment, or legal advice. Please confer with your advisor, lawyer, or accountant for specific advice.